I am Dr. Kausik Chaudhuri, posted at Department of Medicine, Beleghata Infectious Disease and General Hospital, Kolkata. We will discuss ambulatory blood pressure monitoring today. Ambulatory blood pressure monitoring provides a 24-hour account of the patient's state and is useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and masked subtypes. It is accurate in predicting the risk of cardiovascular disease and mortality. Blood pressure level measurement using home or ambulatory blood pressure monitoring is recommended in patients with office blood pressure classified as high normal or grade 1 hypertension. That means systolic blood pressure between 130 to 159 millimeter mercury and diastolic blood pressure between 85 to 99 millimeter mercury. That is called high normal blood pressure or grade 1 hypertension. And ambulatory blood pressure monitoring provides the average of blood pressure readings over a defined period, usually 24 hours. The device is typically programmed to record blood pressure at 15 to 30 minutes intervals, and the average blood pressure values are usually provided for daytime, nighttime, and 24 hours. A diary of the patient's activities and sleep time can also be recorded. A minimum of 70% usable blood pressure recordings are required for a valid ambulatory blood pressure monitoring measurement session. ABPM or ambulatory blood pressure monitoring values are on average lower than the office blood pressure values, what we measure in the hospital or nursing home or clinics, and the diagnostic threshold for hypertension in case of ABPM is more than is equal to 130 millimeter mercury systolic and 80 millimeter mercury diastolic over 24 hours, and greater than is equal to 135 by 85 millimeter mercury for the daytime average, and greater than is equal to 120 by 70 millimeter mercury for the nighttime average. So these all three figures, that is 130 by 80 in 24 hours, 135 by 85 in daytime, and 120 by 70 in nighttime, these all are equivalent to office blood pressure monitoring more than is equal to 140 by 90 millimeter mercury. So our threshold for ABPM is less in daytime, nighttime, and 24 hours. What are the advantages? Advantages of blood pressure, ambulatory blood pressure monitoring is it is a better predictor of hypertension-mediated organ damage, that is called HMOD. It is better predictor of HMOD than office blood pressure. 24 hours ambulatory blood pressure mean has been consistently shown to have a closer relationship with morbid or fatal events and more sensitive risk predictor than the office blood pressure of CV outcomes such as coronary morbid or fatal events and stroke. And it can identify the white coat and masked hypertension also. It is a stronger prognostic evidence also. It has a stronger prognostic evidence, and is nighttime recording. It is another advantage of ABPM, and another advantage is measurement in real life settings, and also the additional prognostic blood pressure phenotypes will be diagnosed, can be diagnosed by ABPM, and it has the characteristics of abundant information from a single measurement session, including short-term blood pressure variability also. And what are the disadvantages? Its disadvantage is very minimum. That is expensive and sometimes limited availability, and it can be uncomfortable to some of the patients as because it is tied in the arm. Ambulatory blood pressure monitoring has become an indispensable tool in the diagnosis and management of hypertension and its therapy. Recent guidelines from European Society of Cardiology, ESC, recommend that diagnosis of hypertension should be based on repeated office BP measurements or ambulatory blood pressure measurement monitoring if economically feasible. This ESC recommendation also corroborates with the ESH recommendation also, that is European Society of Hypertension Guideline recommendation in 2023. So office blood pressure measurement and ambulatory blood pressure measurement monitoring is the key of the diagnosis and also monitoring blood pressure. So analysis of various indices on the ABPM graph, such as hyperbaric index, diurnal index, dipping, and other indices can provide useful information about the prognosis of diseases such as hypertension, diabetes mellitus, CKD, chronic kidney disease, and so on. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment. In addition, ambulatory blood pressure monitoring is the single most effective tool to diagnose white coat, masked, and nocturnal hypertension and can help direct the treatment in such patients when required. Overall, ambulatory blood pressure monitoring readings can guide towards the prognosis of underlying organ damage and can be a useful predictor of cardiovascular risk. Thank you.